Across the country, physicians are breaking free from big hospital systems. They're taking control of their practices and changing the care that is delivered for the better. Veronica De La Cruz is in New England with this story.
Hey, Dr. Drew, I'm here in Boston, Massachusetts. It's a city with a skyline that's filled with some of the bigger names in medicine. Dr. Jasen Gundersen isn't just a doctor. He's also an entrepreneur and a patient who began cycling for health reasons.
I'm a cardiology patient myself, and I was very fortunate that I was able to access care early and really kind of get the prevention I needed. And I'd like to see more people be able to have that same level of access.
No stranger to steep climbs on the road or in medicine, Gundersen launched CardioOne.
We are a practice enablement platform. That's a fancy word for we help cardiologists do the business side so that they can focus on the clinical side. So we do things from the medical record to insurance to billing. It's really about letting the doctors be doctors again.
The platform has been helping physicians like Doctors Flynn and Jelani. Now they can focus on shorter wait times and preventative care while using hospital-grade equipment like this PET scan machine, bringing the patient experience full circle.
It's much more affordable for our patients because the way things are billed in the outpatient setting is instrumentally less than what it is in the hospital.
I think that people that need to drive change right now and be transformative in healthcare are the physicians. You know, with CardioOne, they help to manage the entire back end for you, so you can still see patients, but then you retain your independence and you can make decisions about, you know, here's how we want to see patients. It's all patient-centric, patient-focused.
With our own private practice, we just have so much more availability for our patients, and they just love that.
Restoring care to healthcare is remarkable. Here now to talk about it and the shift in how doctors are approaching their practice is Dr. Jasen Gundersen, joining me live from Norway. Jasen has been on a cycling tour of the country of Norway. I'm jealous, Jasen. Thank you for spending some time with us today.
Thank you for having me. It's great to be here. I wish I could be there in person, but great to see technology at work.
Yeah, tell us how it works.
We are a practice management solution, and we built the company to support independent cardiologists. So we take all the non-doctoring work away from the doctors so that they can focus on practicing medicine. It's everything from technology to billing, workforce, integrations, you name it. But we let the docs focus on the medicine, and we focus on all the business parts.
So the things that take the most time are pre-clearances, you know, the getting the clearance for procedures, and then getting the procedures billed, and then getting the procedures scheduled, and then getting the follow-up and dealing with the families. And then how do you deal with all that through CardioOne?
And it's really designed so that the physicians can focus on being physicians. Hey, I think that's frustrated so many doctors and led doctors to going to working for big health systems is It's pretty hard to practice right now.
Well, and I'm guessing it scares them to even try private practice because it looks so incredibly expensive to run a practice.
It's expensive, time consuming, and I don't know about yourself, but like we didn't get a lot of training in medical school about how to run a business. So
not only that, I didn't go into medicine to do that stuff. That had nothing to do with my interest, right? It's the opposite of what we intended to do.
Exactly. And that's what we try to solve for. You focus on medicine, we'll take care of the rest. We're a relatively young company, and we started about 3 years ago. We put the idea together. We've got a number of practices around the country, and one of our flagship practices in New Hampshire that we've seen them leave a hospital employment and move out on their own, and just seeing that practice flourish. Great patient access, great cost of care, great physicians, and they're truly happy and enjoying being doctors again, which is refreshing to see in today's environment.
And what happened to you, and how did you sort of see it from the patient perspective?
So I have really bad coronary disease from a bad cholesterol disorder, and then I have a heart rhythm problem called SVT. So I've had to access care a number of times and really struggle with, calling up and finding out that it would take 3 months or 4 months to get in to see somebody, or I've had some pretty outstanding bills come in from hospitals that have for routine testing. We really need to look at healthcare as the consumer. Like if you're a patient, it's pretty scary.
Yeah.
And you need to get care. You need to find a better way to do it.
Right. You're a physician, but imagine you're not and you're trying to navigate healthcare. It's just ridiculous.
And
I'll tell you what what inspires me is young people thriving. You got to get them coming out of residency and get them not to become employees and to maintain their autonomy and their judgment the way they were trained straight out of residency. Can you do that?
Yes, I think we're the first option that they've had.
Well, this is the way it's supposed to be. I'm sure you feel that way too. So I commend you for doing what you're doing. What does the future look like for you? Do you imagine other companies doing this? Are you going to be the only game in town? Or is this going to be the way the majority of physicians move, do you think?
I hope that we see a significant rise in independent physicians across all specialties in the coming years. I think the healthcare system needs it. Patients need it.
I thank you for being here and sharing this, and thank you for doing this project, and good luck on your, is it a bike tour or a bike race? What is it?
It's a tour of Norway. It's a great place to visit.
We'll keep in touch with you. Thank you so much for what you're doing.
Thank you so much.
Cheers. CardioOne, everybody. If you want to find out more, whether you're a patient yourself or you're actually a cardiologist and you want to get more information, go to CardioOne. It's the word one, CardioOne. So it's CardioOne.com. And we've got more ahead. Don't go away.